I had a triple bypass surgery in Guadalajara 2 months ago. I initially went to the doctors with small chest pain, and through several tests, they immediately found out that I needed fairly urgent heart surgery. And Dr. Victal in Guadalajara was recommended by my heart specialist.
I arrived to Guadalajara 32 years ago when I began like a cardiovascular surgeon. So I have more than 30 years like a cardiac surgeon, and I made a lot of different procedures, especially coronary bypass, valve procedures, and great vessels surgery. All my training was in Mexico City, my first and former training, and I have 2 or 3 fellowships in Brazil, in Spain, and in USA. Especially, I remember one very nice training in the Jackson Memorial Hospital with Dr. Salerno.
The surgery they do, which is called beating heart surgery, is a special surgery where there's the least amount of invasiveness. It's still invasive, they still have to open your chest, but the heart doesn't have to be stopped, the lungs are full. So the recovery time is much shorter. It's state of the art.
The state of art in the cardiac surgery is the off-pump beating heart surgery and the using of endoprosthesis in the valves or in the arteries.
Recovery in the hospital afterwards was unlike anything I would imagine for that type of surgery. The openness of the hospital, where you have a courtyard and you can be outside and you can recover in fresh air and sunlight, was so unlike any other hospital experience I've ever had. It was just really wonderful. It was relaxing. We spent 4 days in the hospital after the surgery. What we saw here was at least as good or more state-of-the-art, more new and more personal than we had ever seen in the United States. So there were absolutely no reservations. But cost-wise, after looking at it, was so much less expensive. It was a fifth of what it would cost for the major surgery like that, with the same state-of-the-art surgeons and technology. It was just amazingly less expensive.
The patients feel when you are a human doctor, a doctor that is thinking like a patient, that is close to the patient and talk with the patient all days. That's the reason that all the patients are really very comfortable and very satisfactory with the results.
After I had the surgery, it's been an interesting experience sharing it with Canadians and with Americans and trying to explain to them the difference and really how it's just as good and priced so differently and so reasonably. But you don't give up quality or technology. And as I said, the personalized service is so different and so much better.